Live from UNR Med Studios, produced by the class of 2027 Genetics Group Number 2, it's Jeopardy!
And I'm your host, Maddie Nellison. Today we're going to be talking about DiGeroge syndrome, a disorder caused by a 22q11.2 deletion that results in poor development of several body systems and complications, including heart defects, immune dysfunction, and developmental delay. Let's get into it.
With us today we have Keenan Downs, David Kim, and Anish Devati.
Hi, for the first question, can we do biology and etiology for 100?
A mutation in which a small part of a chromosome is missing.
What is a chromosomal microdeletion?
Yes, that's right.
Inheritance for 3, please, Maddie.
While the 22q11.2 deletion that characterizes DGS occurs as a spontaneous new mutation, DGS can also be rarely inherited by this pattern of inheritance.
What is autosomal dominant?
Correct. 10% of cases are inherited. 90% of cases occur due to spontaneous deletion in germ cells or early fetal cells.
Clinical for 400, please.
Low levels of calcium that can lead to complications like seizures.
What is hypocalcemia?
Yep, that's right. With DGS, patients may have smaller parathyroid glands, resulting in hypoparathyroidism. This means that there are low parathyroid hormone levels, leading to low calcium and high phosphorus levels.
Biology and etiology for 200, please.
This gene encodes a transcription factor, and its defective activity plays a major role in the development of this disease.
What is T-box transcription factor 1?
Wow, that's impressive. Among the genes affected by DGS, the one that has been studied the most is T-box transcription factor 1, or TBX1. TBX correlates with defects in the development of the heart, thymus, and parathyroid glands, as well as anomalies responsible for behavioral and developmental abnormalities.
Miscellaneous for 300, please.
These DGS neuropsychiatric symptoms include delays in toddler speech and learning difficulties, ADHD, autism spectrum disorder, depression, and anxiety.
What are learning, behavioral, and mental problems for DGS?
There we go, that's it.
Miscellaneous for 100, please.
This statistic describes the frequency of DGS in a population as 1 out of 4,000.
What is incidence?
Yes, that's right.
Clinical for 100, please.
This facial feature can be described as a short or flattened groove in the upper lip.
What is cleft palate?
Correct. Other facial features include underdeveloped chin, low-set ears, and wide-set and/or hooded eyes.
Miscellaneous for 200.
The most severe form of DGS, in which affected individuals have a total absence of the thymus. With treatment, lifespan is about 2 years.
What is complete DiGeroge syndrome?
Correct. While there are no common prognosis due to the variable expressivity, the most severe manifestation has a 2-year lifespan. Most patients have a normal life expectancy with mild symptoms.
Inheritance for 4, please.
This principle describes how signs and symptoms may be congenital or appear later in infancy, as well as describing the severity and type of symptoms.
What is variable expressivity?
Correct.
Biology and etiology for 300, please.
These pouches develop into the thymus and parathyroid glands.
What are pharyngeal pouches 3 and 4?
Yes, that's right. DGS affects the TBX1 gene, which is responsible for pharyngeal pouches 3 and 4, and leads to the impaired development and function of the thyroid and parathyroid glands, as well as the mesoderm, resulting in complications commonly seen with DGS.
Diagnosis for 100, please.
This category of tests include amniocentesis and chorionic villus sampling, or CVS.
What are prenatal diagnostic methods?
Yes, that's right. CVS is a test that analyzes the fetal chromosomes and cells taken from the placenta that is done during the first trimester. And amniocentesis is a test that analyzes the fetal chromosomes and cells taken from amniotic fluid that is done during the second trimester.
Inheritance for 1, please.
The chromosome on which the DGS microdeletion occurs.
What is chromosome 22?
Yes, that's right.
Diagnosis and treatment for 200, please.
A technique that involves using fluorescent molecules attached to DNA or RNA probes that can be used for gene mapping, diagnosis of genetic diseases, and whole genome screening.
What is lobster?
Nope.
What is fish?
You got it.
Inheritance for 200, please.
For DiGeroge syndrome, the statistic is 1 out of 4,000.
What is the recurrence risk?
Yes, that's right. This number may sound familiar. This is also the statistic for incidence.
Miscellaneous for 400, please.
This mnemonic describes DGS, conotruncal cardiac abnormalities, abnormal facies, thymic hypoplasia, cleft palate, hypocalcemia, 22q 11.2 microdeletion.
What is the catch-22 mnemonic?
Correct. Although not a diagnostic tool, this is a helpful way for students to memorize the key features of DGS.
Clinical for 300, please.
This occurs when the gland that is the site of T cell maturation is small or missing, resulting in poor immune function and frequent severe infections due to affected T lymphocyte production.
What is thymus gland dysfunction?
Wow, that's impressive.
Diagnosis for 300, please.
A fat-soluble vitamin used to treat hypoparathyroidism, commonly found in orange juice and fatty fish.
What is vitamin D?
Yep, that's right. Other treatments include antibiotics, calcium supplements, ear tubes to improve hearing, and occupational therapy. However, treatment involves managing the symptoms as there is no cure for DGS.
Diagnosis and treatment for 400, please.
This plan for DGS patients involves following a normal vaccine schedule, treating infections and immune system improvement with age.
What is the treatment for limited thymus function?
Yes, that's right. This combination of two treatments for a patient with DGS presenting with the following lab results. Serum calcium level of 6.6 milligrams per deciliter, showing hypocalcemia. Phosphorus of 8 milligrams per deciliter, showing hyperphosphatemia. Thymus not visualized during scintigraphy evaluation. Nope.
Calcium and phosphorus? Wait, no, potassium. Oh,
Nope.
Calcium and calcitriol? Vitamin D?
There we go, that's it. These lab results showed hypocalcemia and hyperphosphatemia. These both arise due to hypoparathyroidism. Hypoparathyroidism can be treated by treating hypocalcemia. Treatment is given supplements of calcium together with oral calcitriol, which is active vitamin D.